Hi there, and welcome to our Friday webinar. Today we are on with Dr. Stephanie Lamb, and we're doing another episode of Avian Vet Insider. And today's topic is the top 5 bird species that Dr. Lamb treats most often, and the top 5 rarest bird species that she treats. So this will be a treat, pun intended, to see who's coming into, what kind of species are coming in there to see you. And I'm sure Arroyo, who is behind you, is there. I almost feel like he's the office greeter. I wonder how does he do when he sees other birds come in, by the way?
Oh, he's happy to see other birds come in. In our old office where we were, he used to actually be up front, kind of behind the reception desk area. So he wasn't like in direct contact with any birds or anything, but certain birds would make him really excited, and he would start doing what he's doing right now, the little like wing flapping thing, begging thing. Some he didn't care about. One time, so he's definitely sort of a chicken. He is afraid of a lot of things. And one time a bird flew from the back area up to the front and landed on his cage. And he just saw the bird coming and he just bailed from his cage. He screamed and he like bailed off the side of his cage because he was just terrified about this other bird who suddenly came around the corner and landed on his cage. But for the most part, he's excited when other birds are in the hospital and other people. You know, he used to be great up front greeting people, and he also really was good about consoling some people too. Like amazingly, he a few times would know if somebody was sad about something. Of course, their body language, you know, we read their body language, so he reads ours. And I've had a couple of times where he actually went up to people and just sat with them as they were sad about something to do with their pet, you know, which is really nice. A very little empathetic bird.
Oh, that's tender. Wow.
Yeah.
Wow. He's just, yeah, he's doing a little dance behind there. I don't know if you call it like a Amazon prance or dance. So there he goes. So Dr. Lamb, I think you have a presentation for us again today, which is awesome. And maybe we have time at the end for some questions. We'll see if we can squeeze some in perhaps. So with that being said, we'll save any kind of questions for the end, and of course use the Q&A button feature instead of chat feature, and we'll go from there. So oh look, he's like perfectly framed behind you. Like, yeah, he's waiting for. Oh, there we go. I misspoke too early. Now he's moving.
All right. I'll go ahead and share my screen so that we can start the PowerPoint here. Oh, he's going to come over and be a part of it. All right, there we go. Okay, so we're talking about the most common species that I get to see, and also the least common species, because, you know, there's so many different species of birds. It changes every year because different taxonomists and different genetic things come out that we may have thought one species was just one species, but then genetic tests show that actually it's 2 different species. Or sometimes we have thought based on taxonomy that 2 different species were 2 totally different species, when in fact they're actually the same species when genetic studies come out. So things do fluctuate a little bit here and there, but generally speaking, there's about 10,000 different species of birds, right? So I would love to see all different 10,000 species of birds in my career. That'd be definitely a goal to work towards, but I don't know if I'm going to get there. In reality, you know, there's a set of species that we see most commonly coming into the hospital. And so I wanted to go over those because, you know, what's coming in most commonly is really going to be the most common pets that people have in their homes. And then also at the end, we're going to do the least common species that I get to see, ones that we just don't really encounter a ton. And of course, there's many species. Again, I haven't seen every species of bird that's out there. So there are many, many, many thousands that I have not seen, but that would take too long to go through. So we're just going to go through a few of the species that are like, oh, that was really cool that I got to see that, but you know, something that still is possible to see in the hospital. So, okay. So we're going to start off again, most common species first. Number one, I think it's probably no surprise at all, is the cockatiel. The cockatiel is an extremely popular pet. And because it's such a popular pet, it's coming into the hospital quite frequently. Whether that's for wellness visits or illness visits, cockatiels definitely are our number one bird that is coming into the hospital. And the other thing is, a lot of people don't just have one cockatiel, they may have two, they may have 10, 30, you know, they could have a whole flock of them. And so a lot of times we'll even have people who may bring in one cockatiel, but then they bring a friend for the cockatiel just to be emotional support, especially if they're a little bonded pair. And it's really rather cute when people do have two cockatiels that come into the hospital together, and one's just sort of the emotional support individual. If I ever have to take a bonded pair apart, like I'm taking one into the back to get blood drawn, or, you know, doing x-rays or something like that, excuse me, sometimes the other individual starts chirping, and sometimes they'll be chirping so that they'll be communicating with each other, where one's in the room with the owner and one's in the back with me, and they're talking back and forth. They're just calling to each other. They're contact calling. So it's really kind of cute when you see those individuals come into the hospital and doing that together. So the other thing I wanted to do with this talk is just talk a little bit about the individual species, and then also some common diseases that I'll see them presenting for. So the cockatiel, the scientific name is Nymphicus hollandicus. And so it's sometimes easy to refer to them, or easier to refer to them by their scientific name, because that is the Latin name, that is the name, no matter where you are in the world, that is the name for that bird. If you go to different countries, you know, different people may call them different things or have a different name. So the Latin name, the genus species name, is Nymphicus hollandicus, and that is what this bird is all across the world. Other names that the cockatiel goes by, and it's funny because when I was looking into other names for the cockatiel, to me it's just, I can't even think of the cockatiel as anything other than the cockatiel. But there are people who do call them different names, and maybe some of our viewers, I know we get viewers from all over the globe, and so maybe some of our viewers might even know them by a different name. But the names that I was able to find, cockatoo parrot, which that makes sense because technically the cockatiel is in the cockatoo family. It's just a tiny cockatoo is really what it is. So cockatoo parrot is one of the names. The other name is Quorion. I never heard that one before. Another one is crested parrot, which also makes sense because it has a little crest on top of its head, and it's a parrot. So there you go. And then a fourth one that I found was called the Weero, Weero. So I might be pronouncing that wrong, and somebody might need to correct me, but I thought that one was really interesting too. So if you hear it go by a different name, it may just be, you know, different cultures have different names for the bird, but Nymphicus hollandicus is the scientific name. They are mainly found in mainland Australia, like the interior of mainland Australia. They do come in a variety of color morphs. So this individual that I have here, this is your standard gray cockatiel. And I will say, when it comes to health, the standard gray cockatiel is really the healthiest of the bunch. Although there's a lot of really beautiful varieties. You know, you have the pearl, you have the white face, the Lutinos. You know, when we are breeding to get certain colorations, sometimes, not always, but sometimes there could potentially be a little bit of line breeding that happens. And sometimes certain genetic changes may pop up. So health-wise, I would say the gray cockatiel tends to be the healthier of the different color varieties. And interestingly, they have quite a long lifespan. Sadly, some of the color morphs don't live as long as the gray, like the whiteface sometimes has a little bit shorter of a lifespan. Of course, there's always exceptions to the rule, but I would say as a generalization, some of the color morphs have shorter lifespans, but the lifespan has been documented between 10 to 33 years. 33 is the oldest one that I've ever met. And the reason for that 10 side is, one, older information. As we've gotten better about our husbandry with birds, we have gotten better about, providing them with what they actually need. And so they're therefore living longer. But it also goes to that genetic information I already mentioned of sometimes when we have these color morphs, they may have had some line breeding to get them to these unique patterns and colors, which might also come along with some other genetic changes that may not be as healthy. But they can live quite a long time, late 20s, early 30s. And again, like I said, the oldest I've ever met was a 33-year-old. Now, as far as any common health issues, because I did want to just touch on it, because a lot of people who have cockatiels, again, they're the number one that we see coming in. So I'm guessing probably other hospitals that are out there across the US and other parts of the world probably see the cockatiel also quite frequently. Very, very common health problem that we see with cockatiels is reproductive problems. They are just really well known for, the females in particular, of course, having hormonal related problems, whether it be things like egg binding, low calcium levels, and getting things like fractures, or cystic changes to the ovary or the oviduct. I mean, dystocias. There's a variety of different things that can happen. Cloacal prolapses. So, but by and far as systems go, reproductive problems are the most common problem that we are encountering with the cockatiel. So, all right, I think that probably comes as no surprise that the cockatiel was number one on the list. Okay, so moving along to number two is the Congo African gray parrot. And the Congo African gray, its scientific name is Psittacus erythicus. And the other names that it goes by is just gray parrot. And that's kind of what a lot of people have been trying to call them more, is just the gray parrot. I think the African gray is something that is more of a popular thing to say, like in the US, but other parts of the country, other parts of the world, I should say, will often call them just the gray parrot. And then I specifically said the Congo because we all know that there is the other gray parrot, the Timna gray parrot, which is a different species. Sometimes people look at them and think that they're the same species, just subspecies of one another, and they're not. This is Psittacus erythicus, actually. So they're two totally different species, and actually genetic testing over time has shown that they're not as closely related as we once thought they were. But of the gray parrots, definitely the Congo is the more common one that we actually see coming into the hospital. And there's, I think, a lot of reason for that. They're really intelligent. They bond really well with their owners, and they're just so personable. The stories that you'll hear from people who have gray parrots, and I mean, I know, one of your guys' webinars is the Gray Way, right? Where you have one webinar a month dedicated to the gray, and the reason for that really is because a lot of people have this particular species, and they're just such a gregarious species and so amazing that it's no wonder that they are really common and thus common coming into the hospital. As far as where they are from West and Central Africa, sort of like in a lowland forest area. Their lifespan, I'm also going to give a range on that, and which is what you're going to find as we're going through all these different species here that we commonly see. And the reason, again, for the range is because there's some older information and then there's newer information. And a lot of times the older information has a little bit more reserved of an age for these guys because they weren't living as long as they really should be, because we didn't know what we were doing maybe a long time ago. And so a lot of them were running into disease problems or issues that shorten their lifespan. So you'll sometimes hear that they have the lower end of their age being around 30, and then upwards of in the 70s. The oldest I have personally met, I've never met one in their 70s, but I have heard of them before. The oldest I've ever met have been in their early 50s. I have a couple of patients who are in their early 50s. I will say as well that we do see a lot of them, unfortunately, that around like mid 20s to early 30s can pass away from cardiovascular diseases. And I know it's something that's been talked about in previous webinars, and we can always do other ones in the future too, about cardiovascular disease. But cardiovascular disease, particularly atherosclerosis, which is a hardening of the arteries, it leads to a narrow diameter to those arteries. So there's less blood flow through the arteries. So if you think about a blood vessel, an artery, it's kind of this like nice big tube that blood is running through. And if they get atherosclerosis, there are these plaques that develop on the inside, and they kind of become smaller and more narrow. And because they're smaller and more narrow, you're not getting as much blood flow and appropriate blood flow to organs and tissues. And then that means you're not getting enough oxygen, you're not getting enough nutrition, you're not getting rid of waste the way that you should. And that is damaging to cells. And so sadly, we do see the African gray as one of the more common species that gets atherosclerosis. And a lot of them, it's more common to see it in like the mid 20s, early 30s when it's happening. Now it can happen honestly really at any time. It can even happen in young birds. It's just more common as birds age. So when it comes to diseases, that's one of the more common diseases that we will see African grays coming in for. Of course, there's a variety of other things that they can come in for too, but that's something that I will see more commonly in them than I would see it in like a macaw or a cockatoo, you know. Now, the other thing that I wanted to mention as a unique, or not unique, but more common disease that we see in the African gray compared to other species is seizures. We do see seizures with some frequency in African grays. I would say I have more African gray patients that have seizure activity than any other group of birds. And there's a variety of different reasons for seizures. So it's not just like one reason. And if you have an African gray and it has seizures, and this is the one reason that causes it, and this is the only test you need to do, and this is the only treatment that you need to do. No, the reality is there's a variety of different things that can cause seizure activity. You can have infections, metabolic disorders like liver problems, low calcium problems. You can have other nutritional problems like low magnesium. You can have cardiovascular disease cause them to have seizure activity. You can have certain viral infections like Bornavirus, which I think you guys just recently had another Bornavirus updated lecture as well. And that can cause seizure activity in these guys. And then there's idiopathic causes, meaning we don't know why it happened, but it happens. Just like in people can have idiopathic epilepsy, or dogs can have idiopathic epilepsy. That's one of the hypotheses behind these guys having their seizure activity too. So it is a common problem that we see when birds do come into the hospital for seizure activity. There is an extensive amount of testing that we need to do with them, because we need to figure out what it is, whether it's blood work to assess liver function and kidney function and look at those nutritional levels, their calcium, their magnesium. We're looking at red cells and white cell counts. We're looking for specific infectious diseases, like maybe testing for Bornavirus, or we're looking for toxins because that can cause it too, or doing x-rays. I mean, there's a whole variety of things that are done. But then we also, of course, need to treat the seizure. And so it involves us trying to figure out what's causing it and treating that, but then also getting them on appropriate medication to deal with seizures. So, all right, next most common species is the budgie. Again, also, I don't think too so shocking or surprising. There's a lot of people that have budgies, and I know, Laura, that you've got a new budgie friend who sounds like they're really amazing. It's what I love about budgies is they're this cute, teeny tiny little creature, and you just would not expect the amount of personality that's packed inside of that little thing to come out of it. And it sounds like you've got one of those who's a real talker and learning quite a variety of things to say, which is really amazing. I've had a few budgies myself. Actually, my first bird that I ever had was, well, it was really actually my sister's bird. But the first bird that was ever a part of my family was a little budgie, and her name was Clarabelle. And she was a great little bird. I've had several since then. And I think a lot of people who aren't even like bird people, this is kind of like the quintessential #1 bird that people think of when you have a little pet bird. The reason they're probably #3 in the list of birds coming into the hospital and not #1, because I really think there's probably more budgies out there that people have than the other species. At least it seems like it. The reason I think they're probably not the #1 coming into the hospital is because I think there's still a lot of people that don't realize they can bring their bird to the hospital. There's still a lot of people that think about veterinarians as, okay, if that's the place you go when you need to spay or neuter your dog or cat and get them their vaccines. And well, my budgie doesn't need any vaccines, so they don't need to go in. But of course, we love to see them because they need health care just as every other animal out there does. And just, routine wellnesses are really helpful to identify underlying problems and treat them appropriately, or just help owners get on the right track with nutrition, behavior stuff, husbandry, all that sort of stuff. So in fact, today I actually saw 2 budgies this morning. So they are quite popular. A lot of people do have this cute little bird. Now, for the budgie, its scientific name is Melopsittacus undulatus. And there's a variety of different names for the budgie. A lot of people in the United States will call this a parakeet. So if you go out on the street and you ask a random person, you show them this picture and you say, what is this? More than likely, they're going to call it a parakeet. Most people think of this as a parakeet, but that's really just kind of more a US thing. They really, it's kind of a misnomer to call them a parakeet. A budgie or a gar is a better name to call them, but of course, if you want to be really scientific, Melopsittacus undulatus, that is the name. So when I was looking up different names for the budgie, I have quite a few different ones. One was the warbling grass parrot, which I thought was a very interesting name, which, grass parrot, again, it's a parrot. They are usually in Australia, where they're searching around in the grass. I mean, and I guess warbling maybe because of the noises it makes. Another name I found for it is the shell parrot, which was interesting. The canary parrot, maybe the canary parrot because of the yellow. That one I'm not too sure. The undulated parrot, which, although that one maybe doesn't sound too intuitive, again, if you think back to the scientific name of Melopsittacus undulatus, it's the undulated parrot. So that last, the species portion of the genus species name is undulated. So also the zebra parrot, probably because of those little stripes that it has on its head and on the wings. And the scalloped parrot is another one, again, probably because of the appearance of the striping. But then I also found, interestingly, that some parts of the world call it a lovebird, which, when I think of a lovebird, this is not what I'm thinking of. I'm thinking of totally different species, different continent even than the budgie is on. So I found that really interesting. As far as where the budgie is from, they are also from the interior and mainland of Australia. So sort of similar to the cockatiel. But there are feral populations that exist in different parts of the world. In Florida, I guess there's a feral population of them. That probably changes as time passes. Okay, as far as the lifespan goes for the budgie. So this one, the span I'm going to tell you is between 5 to 12 years. And the reason I'm going to tell you that, again, it seems like a very wide span. One of the most common problems that we see these little guys come in for, unfortunately, is cancer. Cancer is really much more common in the budgie than some other species. I mean, it happens in all types of animals, of course. It's a problem for all different species. But budgies, when it comes to the pet birds, they're kind of the poster children for cancers. And it seems like a lot of them that do get cancers will get cancers right around like 5 years of age. And of course, if they're getting cancers, unfortunately, there are treatments that we can do for certain cancers, but there's some more serious ones, like if they get cancers of the kidneys. There's certain brain tumors that they get called pituitary adenomas. Some of these cancers are a little more difficult for us to treat. And so it's common sometimes for those cancers to pop up around 5 years of age. And therefore some of them pass early in life because of that, or sooner in life than we would like them to. But if they kind of make it beyond that 5 years of age, then they can live up to 10 to 12, I would say is average, if we make a bird or have a bird be able to go beyond that sort of delicate time right around 5 years where a lot of them pass. So therefore, what I was going to say as far as the most common health issue that these guys get is, again, cancer. And I was just looking up some data actually about cancer in birds, just for anybody who is sort of interested in numbers. There's different surveys that have been done throughout the years looking at patients that have come into hospitals or pathology services to see what sort of disease incidence is out there. And one of the more recent studies showed a cancer incidence of 6.2%. However, different studies show different things. So there's been a range reported as low as like about 3% to as high as 24, but one of the most recent studies that had over 3,000 birds in this study, it was about 6.2% of birds had cancer as a disease that caused them to pass. So, all right, next species. Number 4, the green cheek conure. Okay, I know this picture isn't maybe necessarily the most clear picture, but I like the picture because I just think it's really cute. I think it shows what the green cheek conure is sort of all about. I think they're really goofy little birds who are high energy and love to get themselves into mischief, whether it's with their other little green cheek conure friends or other individuals in the home. So this little green cheek conure who's trying to lick the camera is just really personifying what they are all about. Now, as far as their genus species name, it is Pyrrhura molina. The other names that they go by, so aside from the green cheek conure, there's the Argentine conure, some people will call them that, or the Santa Cruz conure is another name that they'll go by. So, but again, the genus species is Pyrrhura molina. As far as where they are, they're a South American species. They are in Brazil, Paraguay, Bolivia, and Argentina. Now, as far as their lifespan goes, I would say that most typically it's going to be the early 20s that these guys will live to. Like 22 to 25 is a typical range of age for the green cheek conure. As far as common health problems, so there's one common health problem I'm going to talk about in a second, but I will say that I feel like a lot of these guys actually are really great birds to have, in that we don't see a lot of like common health problems specific to the green cheek conure. Yes, they get a variety of different illnesses just like any other individual, but there wasn't one that I could really think of off the top of my head initially that I could say is, this is a green cheek conure problem. Then I sat and thought about it for a little bit longer, and then I realized what it was that I would consider to be more common in the green cheek conure as a problem than in other species. And what that is ingestion of fibrous material that they should not be ingesting. So I'm going to get on my soapbox for just a moment here. As a veterinarian, you'll see certain problems that come about, and we always want to prevent problems as opposed to treating problems, right? Because The old adage of an ounce of prevention is worth a pound of cure is absolutely true. It's so much better for us to be able to try to prevent problems than to treat them, because some problems are very difficult to treat when they've occurred. And the little like fuzzy hut things that people will get for their birds, that conures absolutely adore to go inside of and like nestle in, and it's kind of their little security area. A lot of conures will sleep inside of them. And a lot of them will do just fine with them. But I will say it's really important, if anybody uses those type of little fibrous hut things, that you really need to be looking on the inside of those huts and checking to see if they have chewed anything. Because if they've chewed some of that, you need to get rid of it, and you need to not give them a fibrous one back. There's other types. There's like the it's like made out of natural fibers, like woven, like little like plant fiber stuff. That's okay, that they can break down and digest. But the fibrous stuff, that's synthetic fibers, like the polyester fibers, those real fuzzy ones, they can't break that down. They can't digest that. And so if they ingest that, and then it gets into their stomach, if they ingest too much, stuff can get obstructed in there. And I have met, unfortunately, several green cheek conures. Other conures do it too, but I will say the green cheek conure seems to have it more commonly happening. Now, it may be because, again, they're number 4 as far as common parrots that are coming into the hospital. So maybe that's why I'm seeing it more common in them than, say, like the Gende conure. But if they ingest those little fibrous portions of those huts, they will not break them down. They don't pass out of the GI tract easily. They get stuck in the stomach, and then they build up over time. And as they build up over time, it causes stretch on the stomach, and then the birds can waste away from it because they're not getting any nutrition, because their food isn't passing through, because they have this big fibrous wad of stuff stuck inside of their proventriculus and ventriculus, and it can be really quite, I mean, it can be deadly, frankly. So I really, if anybody has those little huts that their birds hang out in, again, they love them. Some of them don't do any damage to those things, but if your bird does do damage to them, don't let them have them. One person said to me, one owner one time brought in their 2-year-old green cheek conure who had adjusted one of those. And sadly, the bird passed away because it had ingested so much and it was just too far along by the time it presented. And the owner said to me, what a waste of life, you know, for just a little hut thing for him to sit inside of. So if you have those at home, just check on the inside of them, make sure the bird has not ingested anything. And if you see things chewed, even if you think the bird's dropping stuff on the floor, I wouldn't even use it. And as far as like, people have tried to like give birds some stuff to like help break it down. So I tried an experiment at home where I took some of the fibers from the Happy Hut material. I put it into a little glass jar with some sulfuric acid, which is a very high pH, not high pH, a very low pH. The pH is actually lower than the stomach acid in the bird, and that stuff is still sitting there. I still have it sitting up on a countertop 3 years later, just waiting to see if it'll ever break down. It's not, but that's just a good example to show that like that stuff, when it gets in the stomach, it's not breaking down, it's not leaving, it's staying there. And if it builds up over time, it can be a real huge problem. So important thing to know about. Okay, next species that's most common, the blue and gold macaw. Blue and gold macaw made it as number 5 in the list here. There's lots of different macaw species that we see, but by and far, blue and gold macaw is just the most common macaw that comes into the hospital. The genus species name for the blue and gold macaw is, and I might mess this up a little bit, so I apologize if this sounds a little bit off. It's Ara Anuna. So there's the genus and species, right? So the name is always 2 names. So Ara is the genus, and then the species is Ara Aruna. So hopefully I said that okay. That one, for whatever reason, I think there's just too many A's and R's back and forth, and that one just like confuses my mind. But the other like names that people will have this bird commonly go by is blue and yellow macaw. And actually a lot of people say that's really the more appropriate name as opposed to the blue and gold macaw that a lot of people in the US call it blue and gold. Really, we should probably be calling it the blue and yellow. That's more the appropriate name, people say. Other names that I could find for this is the blue macaw and the yellow-breasted macaw, which, you know, both those make sense. Again, they're blue on one side and yellow on the other, so I could see how some people may just call them blue and some people will call them the yellow-breasted. As far as where they're from, they are also a South American species. They're kind of from Panama to Colombia, and then again in Peru, Venezuela, Brazil, Paraguay, and Bolivia. With their lifespan, they are living somewhere between like 60 to 80 is a good estimate for the lifespan of the blue and gold macaw. And personally here at the hospital, the oldest ones that I have met, I've met a few in their 60s. I haven't met any older than their 60s, but I've met a few in their 60s. Common health issues. This one also was a little hard for me to think of a common health problem that we see them for. And it really, this one I couldn't come up with something specific to them because they get a lot of just bird health problems, but there wasn't anything that I felt like, aha, this is the blue and gold macaw problem, and it's something that is more commonly seen in them than other species. There is one thing that I think is, I guess, a little bit unique that I can mention, and part of it is present in this picture here. This particular blue and gold macaw, you can see that the tip of the beak from about the mid-culmen here to the end here, you can see that you have this like big ridge, which isn't a big deal. And the picture doesn't do it justice, really. It looks a little too pixelated now that it's all blown up and big. But the tip of the beak here is kind of irregular. And I've met several blue and gold macaws that are overweight, and it seems to always be an overweight blue and gold macaw thing, that they end up having some like abscesses that form in the beak, and then it causes the beak to grow out very irregular. So the upper portion of the beak looks okay, but then they'll get like this little abscess underneath, and then the rest of it grows out odd. And I really don't know exactly why that happens. Sort of I would say the jury's still out as to why that occurs, but it is, with other veterinarians that I've talked to in other parts of the country, something that they've noticed too, that chubby blue and gold macaws, more common to see beak abscess and beak lesions that cause irregular growth to the beak. So, but it's something we're still probably figuring out. I mean, my hypothesis, because it's commonly seen when they're overweight, is that it probably has something to do with poor blood flow and poor circulation, because when you do blood work on these birds, they usually have really high fat levels. And birds are amazing. I mean, the level that their cholesterol and their triglycerides can get to, if that happened in a mammal, like, I mean, if it was in a person, we would be having like embolisms. We would not survive. But birds are amazing, and they can have really high fat levels and do okay. So my hypothesis, and we'll see, time will tell, hopefully, that it may be that there's too much fat in the blood. It's causing turbulent flow. Maybe we're not getting as much nutrition and oxygenation, and then you end up getting these areas where tissue dies off because it's not getting appropriate blood flow, and then thus this little sterile abscess happens. So, all right, next thing was there was a bonus that I wanted to just talk about, because I was doing top 5 most common and top 5 least common, but I wanted to throw in the bonus of the chicken, because we do see a lot of chickens in the hospital, and it's funny because most of the time when we see a chicken, the owners say, I must be the only person who brings my chicken in. Like, I probably hear that at least once a week from an owner. And I end up usually saying to them, like, no, this is like the, second or third chicken I've seen today. So we do see a lot of chickens. Chickens are fun. They are a domesticated species. All the species we've talked about so far were not domesticated. This is domesticated. It's the genus species is Gallus domesticus. And there's a whole bunch of different breeds of them in the picture here. The 3 pictures, the one that's up in the corner with me, and that was my rooster that I had. He's a Rhode Island red. The one with a white fluffy head, that's a Polish hen. And then the one down in the lower right corner is a laced Wyandotte. So there's a whole bunch of different types of them, different personalities. They're really fun. Most of the time people get them because they're like, aha, we're going to have eggs. It's going to be so nice. We're going to be our own little, backyard farmers. And then they have the chickens and they learn how cool they are and how fun they are to interact with, and then they become pets. So that was just the bonus bird I wanted to throw in for you guys. Okay, so now we're going to move on to the least common species. All right. So first least common, which I didn't really have like a 1, 2, 3, 4, 5, because again, we're talking about least common. So most of these I've only seen like once. So, I couldn't really order them 1 through 5 of who is the most least common. So this one is the Port Lincoln parrot. I put the genus species up there for you guys to see there. Barnardius zonarius, I guess is probably how you pronounce that. We'll see. Someone might be better at pronouncing it than me, but then I listed also several other names. They're also an Australian species, like a couple of the others that we talked about. I have only ever seen one of these birds in the hospital before, and this is actually her. This is Miss Mo is her name, and she is owned by one of my clients who is fabulous and takes in a lot of rescue birds. She really has a huge heart, and this little bird came to her with a neurologic problem. So with the other species, I was talking about what the most common health issues are that we see in them. I don't really have that for this least common species because, again, some of these are so infrequently coming into the hospital that's really hard for us to say what's really common or not common as disease problems in them. This one that I have met has some neurologic problems that we don't know why it originated, but this one we actually took up to see Dr. Scott Eccles. I know you guys had him on not too long ago as well. We had taken him from Arizona up to Utah to go see Dr. Scott Eccles. We actually did an MRI at the University of Utah with this little one and found that she has a sort of different, she's got changes to her brain, the cerebellum, which is the portion of the brain that's sort of helping with coordination of movements and like fine motor control. And if you were to watch this bird walk, she kind of like wobbles back and forth. And her cerebellum was very irregular. Now, we don't know why it happened, but ultimately Dr. Scott Eccles gave her the diagnosis of she's got brain mush. So kind of tells you that that portion of her brain just isn't quite right. But she's doing great because of the owner who has her, who does a really good job with her. She's doing fine. So that's one species. All right, the Dirkop's cockatoo. I put this one up. You'll notice that I didn't have any Amazons or any cockatoos in the most common species, because again, I was looking at like what we actually see as the most common coming into the hospital. And although we do commonly see Amazons, there's so many different varieties of Amazons that no single Amazon like was able to like make it to the top 5 list. And then same thing with the cockatoos. We see lots of cockatoos, but we see a variety of different cockatoos that again, not a single one really made it to the top of the list there. So the Dirkop's cockatoo is one that I've seen 2 times as a veterinarian. And that's it. Not a lot of people have this cute little cockatoo, sorry. They're a little smaller size, but they're not extremely tiny. You can kind of tell the difference with them compared to others because they have this really beautiful blue eye ring and sort of this short crest. So again, I don't have a great thing to tell you guys as far as common diseases with the Dirkop's cockatoo because I've only seen a couple, so it's hard for me to identify like, oh yeah, this is the most common problem that I actually see them for. So in fact, I think the 2 that I've seen were for wellness purposes, if I remember correctly. Again, I'm thinking of 2 birds over 11 years that I've been a vet, so I could be remembering slightly off. But that's them. All right, this group of parrots I wanted to go over too. So in the most common species, we talked about the Pyrrhura molina, which is the green sheep conure. There's a whole bunch of other Pyrrhura genus conures. And it's neat because you look at them and you can go, yeah, that kind of looks like a green cheek. Like if you look at this one up at the top here, this is the pearly. And you can see, well, yeah, that looks like a green cheek. I mean, it's got a very similar head shape. Look at that white eye ring, black colored beak, it looks like a green cheek, but you're like, yeah, it's not quite a green cheek. And one of the things with the green cheek conures is people are, doing a variety of different breeding techniques to get them a variety of different colors. So that kind of makes it also a little more confusing, because if you don't see the standard green cheek and you see like a follow green cheek or the pineapple green cheek, you may think that it's a different species when in fact it's actually just a green cheek conure. Whereas these guys, these are different species of the Pyrrhura genus conure. So again, the green cheek is a Pyrrhura genus, but the species is Moline. These are all different species. So again, Pearly is up here. These are the white-eared. And so you kind of have to look and be like, well, why was this one called the white-eared when this one also has a white ear? I don't know. But that's what makes it a little difficult for me, because I don't get to see these guys too often. I have one client in particular who has a variety of these guys. So it's really awesome when they come into the hospital, because I get to see all these different Pyrrhura genus species, but there's only one owner that I have that has all the different ones. So that's why I put them as the least common, because I haven't, other than that one owner who has these guys, I haven't seen anybody else with them. The painted is up here. The rose fronted, you can kind of see how that one got its name, because it's kind of rosy at the front. It's also called the rosifrons, is the other name for it. And then fiery shouldered, which you can see how that one probably got its name because its shoulder is fiery, it's this yellow orangey color. So, but there's a variety out there. So and then there's other ones that are more common, like the black-capped conure. You have your green cheek conure, which is probably the most common, and then there's black-capped, which is probably second most common in the Pyrrhura, and then there's the maroon-bellied conure. So those guys are the more common Pyrrhura genus. You're going to see them more frequently, but only intermittently do we ever get to see these ones in the hospital. So, okay, rosellas. I think rosellas probably used to be more common than what they are now, like 20, 30, 40 years ago were more common in the pet trade. Not super common now. Again, I've probably seen like 2 of these in my time as a veterinarian. They're really cute, but a lot of people will say that they are much more of an aviary bird as opposed to a real pet that is going to be coming out and interacting with you. And that's probably why they maybe are a little less commonly found in the pet trade nowadays than they used to, because they really are an aviary bird. So, okay. This one was a fun one. So this is an eclectus, but it's a blue eclectus. And so it's the only one that I've ever seen in person as a blue eclectus. I've seen pictures of them, but this is the only one that I have ever gotten to meet. Now, of course, we see eclectuses, the typical, coloration very frequently. Again, they didn't make the top 5 list, but we do see them very frequently. But this is the only blue one I've ever seen. So I was like, he has to make it into this talk, because he's just really quite astounding when you see him. And I feel like the picture doesn't even do him justice, because when you see him in real life, he's just really amazing. And I also put him in the talk because I wanted to bring up the difference in feather color, and sort of how the blue and green pigments actually are present in the bird's feathers. So just fun fact. All right, when you're looking at colors on a bird's feathers, there's essentially 3 different things that make up color. There's pigmentary colors, there's structural colors, and then there's iridescence. So those are like the 3 different things that contribute to color on a bird, and what our eyes are perceiving. For the pigmentary colors, there actually is no blue pigment and no green pigment, and other than one group of birds, the turacos. The turaco has an actual green pigment, but every other bird that you see in the bird world, if you see green, like Arroyo, he actually truly does not have any green pigment in him. And your eclectus, the male eclectus, which is normally green, they don't actually truly have green pigment. What it is it's actually a combination of yellow pigment with structural color on top of it. Blue also is not a color actually in the bird world. So when you see blue, it's actually it's a structural color, not a pigmentary color. Hopefully that I made that make sense. So this bird here, this eclectus here, who normally would be green, or like Arroyo who's behind me, who's green, or green to our eyes. Green birds are a combination of yellow pigment plus blue structure coming over each other and making them look green. Okay. So if you look like at Arroyo's head, which he's not showing his head so much right now, but he has the yellow on the front, you know, so like he just has the yellow pigment there. He doesn't have the blue structure. He's got the tiniest little bit of blue structure pigment up there, but it's really, really teeny tiny. Arroyo's just got very little blue. So this eclectus here, who again would normally have that green coloration, is a combination of yellow pigment plus blue structure overlapped on each other. This blue eclectus, all the difference is it just doesn't have that yellow pigment. So now it just has the blue structural. That's what makes it blue. So it's just lacking yellow pigment. That's all that it is. But it's fun to just kind of think about that with birds. Now, again, just the Turraco, which is a South American species, when they have green, they are the only ones that actually have green pigment. And it's a very special pigment. It is called Turraco verdum is the name of it. They're the only birds that, I guess, that we know of really, that have actual pigment, green pigment. All those other green birds out there, it's two different things combined together. So there you go, fun fact. All right, moving along. Okay, so bonus group that I wanted to go over as well is just a couple of endangered species. And I will say that I get to see these species common, but I put them up here because they're endangered. So a lot of people don't ever get to see these species, will never see these species. So two of the species that I get to see with some frequency, not making the top 5 by any means, but with some frequency, is the California condor. The California condor, of course, is in a very specific portion of the US. They don't have a huge range. They also actually go down a little into Mexico as well. But in the US, we're looking at California, Utah, Arizona, Nevada, and then they go down along the Baja Peninsula in Mexico. But they're just really in a little tiny corner of the world, right? And at this point, there's only about 400, a little over 400, I forget the exact number, but mid 400s of these birds in the world, and that's it. And I feel very, very lucky that I get to be one of the individuals who gets to see them as a veterinarian. There's many avian veterinarians who never get to see these guys, and they're really quite fascinating and amazing to work with. They're huge, and it's really awesome to be able to be a part of getting to work with a species that is endangered, because you're getting out there and being able to improve their health and get other individuals back out into the wild if they are coming in for problems. So that's really an awesome species that I get to work with that's not a common species. And then the other one is the masked bobwhite quail. And most people probably don't even know what the masked bobwhite quail is. There's several different types of bobwhite quail. And probably when most people think about bobwhite quail, if they ever think about bobwhite quail, is they're probably thinking about the northern bobwhite quail. They're a much more common species. They're also farmed. But the masked bobwhite quail lives in, like, if you look at a map of Arizona, they live in like a little dot at the south west corner of Arizona, just right over the border, and that's it. They literally live in this like one teeny tiny little portion of Arizona, and so they're extremely endangered, and there has been efforts to reintroduce them into the wild. It's been going on intermittently since the 70s. There was a great write-up about them actually recently in Audubon, and what's awesome about these guys is I get to be a part of helping their reintroduction program too. We actually, the program, portion of the program that I get to work with, though I do a little bit of their healthcare, I don't do a ton of it because actually they're really well managed. So a lot of these guys stay pretty healthy. The main thing that I get to do with them is in their reintroduction process, the quails need an adult quail. So baby quail need an adult quail to like teach them how to be a quail, teach them how to like live out in the world. And so it's hard to just have a couple of, you breed your 2 adult quail in captivity, they have like 10 babies, and you can't just be like, go on little quail out into the wild and make it, everything's going to be okay. They have to go out there with somebody. But if you're having individuals staying in captivity and you're trying to breed them so you're getting more out there, they really, those individuals who are in captivity are kind of high value and need to keep breeding so that they can produce more babies so that we can get more birds out there. So they end up having to put these birds out with other quail that are surrogate parents, and they choose the Texas bobwhite quail, which is another subspecies. So the biologists go out and capture Texas bobwhite quail, males specifically. And then where I come in is I actually do vasectomies on those male Texas bobwhite quail. And then the biologists pair those vasectomized males with the baby masked bobwhite quails so that they can be the surrogate parents and they can go out there and into the wild and teach them how to be a quail. The reason they're vasectomized is because they are just subspecies of one another. And so technically they could interbreed. And if we're working with an endangered species, like the last thing we want to do is dilute out the genetics and have them interbreeding and then like with another subspecies, like that's not the whole point of conservation efforts with an endangered species. So we have to make it so that if those baby masked bobwhite quail grow up and decide that they did want to mate with a Texas bobwhite quail, that it would not be successful. And so that's why they have to be vasectomized. So those are just a couple of uncommon species that I get to see. No, they're not pets, and no, they're not parrots, but still it's really neat to get to work with them. So that's the end of what I have for you guys. I'm going to stop sharing my screen at this point. And I'm ready to answer any questions.
Oh, that was fascinating. I'm dying to know myself if you've ever seen this bird. Ready? I'm going to share my screen. A shoebill.
No, I haven't. That would be a really neat one to get to work with too, but I have not gotten to work with a shoebill ever. I know people who have, but not me.
That one is like, there's some photos of the shoebills online that it's like the stuff of your nightmares because they have a really good look. But I think they're awesome. Anyways, sorry, that was fun. Hey, so Dr. Lim, I had a question for you. As when you treat cockatiels and budgies and some of the more common species, do you also notice, like, do you ever have a cockatiel that's like really big for what you would imagine or really small, like as far as size differences in any of these?
Absolutely. Yeah. Like the cockatiels, honestly, there is a variability in their size. You'll have individuals who are appropriate body condition at like 75 grams, and you'll have some up to like 120 grams of weight that are still appropriate. Now, of course, there's also individuals who are at those ranges and they're inappropriate with their weight, but I have absolutely seen individuals who've been at either end of the range and have been normal, they're healthy, they're just really small, or they're really big and like muscular.
Like big bone wouldn't quite be the right word.
Yeah.
But, and I know like with the English budgies, those are like really big compared to regular size budgies. They're like,
yes.
Do you see very many English budgies?
I do get to see English budgies. The American is much more common here, but I definitely get to see the English budgies. And man, they are just so cute when you get to see them because they're big and their heads usually are like bigger and fluffier, and they look a little more serious.
It looks like they should have like a cup of tea. I don't know. They just look so regal.
They do. Absolutely.
And then so when you're treating when you get to see a California condor, are you I imagine one that they're coming in way ahead of time, but like the PP, personal protection equipment, do you have to like gear up when you're working with like a bird of that magnitude?
So definitely when we're working with the raptors, like if you're working with a golden eagle or a bald eagle, yeah, like you absolutely have to have good thick gloves on because those feet are really dangerous. Now, the condors, what's dangerous about them is their beak. So their feet, they can kick and you might get hit with being kicked, but it's not going to be horrible. What's going to hurt and what's going to cause damage is if they grab you with their beak. And so whenever I'm working with them, I'm always working with people who are experienced in grabbing them. I actually personally have never grabbed a California condor myself because there's always somebody else who's there grabbing them for me. There's two specific people that I will work with that are the skilled individuals who know exactly how to grab them appropriately, where to grab them first, how to handle them, and get them restrained. And like they can be dangerous. So yes, you do have to be wearing the appropriate things, but you need to know how to grab them too. It's definitely a skill.
Interesting. And their wingspan alone is enough to knock down anything. It's
Yeah.
all your valuables. There's a video, I think, earlier this year of ones that landed on someone's mom's back patio, and they knocked down like all the patio planters because their wingspan. I think that would help.
Yes.
Massive wings. Well, that was fascinating. No, I mean, it's interesting to see how the birds have, like the conure with the ingesting the fibers. That's something that is a good takeaway too, to watch what you're putting in your bird's cage.
Yeah.
At least some spot checking. That was a very interesting presentation. Thank you so much. I guess I'm going to announce. I have another awesome video to play today, real quick, as I announce our winner of today's webinar, and that is Bob T. Congratulations, Bob. I'm going to play another. I just love these videos so much. And as I go into this video, I just want to remind people that we'll be back next week with Dr. Tom Tolley with Ask the Vet. And then we'll have a little break and we'll come back in December. So on that note, Bob, this is what you will be receiving. Let me do my screen share. And Dr. Lamb, thank you once again for joining us on these Ask the Vets. They're very, very informative, very important.
Of course.
There we go. Okay.
Thanksgiving.
Yeah, this is going to be awesome.
To celebrate Thanksgiving, eating some classic Nutriberries.
Sorry, there we go. There we go.
Those are pretty delicious, aren't they, Arroyo?
I love the table setup too.
Mm-hmm.
Is it not playing? Is he not moving?
No, it doesn't look like it's playing.
I'm so grateful this year for Thanksgiving.
Let me rewind this. This is too good. Okay, I'm sorry.
So grateful this year. He's getting to celebrate Thanksgiving, eating some classic Nutriberries. Those are pretty delicious, aren't they, Arroyo?
There's something to be thankful for.
Mm-hmm.
Some yummy Nutriberries, classic Nutriberries. Yeah, that was awesome. I love it. Arroyo is like he likes to eat any kind of Lafeber product. He's just like a great spokesperson, so to speak.
Yeah.
There we go. Formulated by a top Avian veterinarians and Avian nutritionists. So that goes out to you, Bob, as well as another Lafeber product of your bird's choice. There we go. Thank you, Dr. Lamb. Very appreciative. Good presentation once again. I love all the slides that you showed too. It's just it adds a nice visual. So thank you. And on that note, we will be back next Friday. Like I said, Dr. Tom Tolley, and then we'll have a little break and we'll be back in December. So until then, everybody have a great weekend. All the best to you and your flock. Bye.
Bye.